I've only got 5 minutes, so I'll be really quick. I was in Milan at the end of last week, signing our first World Food Pact, and the head of the WHO said very simply, diet-related illness is the primary cause of ill health across the globe now. So it slightly saddens me that food doesn't get a big look in here, but we are doing a great deal about it, and I would urge a lot more joined-up thinking and a lot tougher approach. Food is something that cities can deal with. It's extremely hard for governments to deal with, not just the fact of the lobbying, but the fact that food is scattered around lots of ministries. Food needs, in my view, both regulation, and it's incredibly cool to hear Boris talk that we're moving towards a sugar tax, as well as the NHS, as well as everything that's coming through from PHE, and I think we'll get there. We do need regulation. We do need government. Oh my God, is someone not all right? We need government intervention around promotions, around advertising, around targeting of children. But we also need to take food down to the absolute ground level. It's one of the few things that has to be attacked from the top and the bottom. And when I say the bottom, I mean literally down on the streets, in the Angel Estate, in communities, about people who are cooking, about the poorest parts of our society, where you can, you do have, as Boris said, a fact I've given him, fast food takeaways drop their prices at 3 o'clock for the school kids. I agree wholly with Jeremy Hunt when he said we need to get like a nanny state around the health of our children. And actually, we have a crisis. We may have a longer life expectancy, but certainly for a lot of people in that society, they're not leading a healthy and thriving life. And that's what we want. I see kids who come into school having had a can of Coke and a packet of crisps. They are not going to learn as well as the others. There's lots of teachers in this city who say the first 2 weeks back in September, the kids are under par because the poor ones have not been fed properly through the holidays. It's a shame, it's a scandal, and we can do things about it. So I've run the food board for Boris now for 7 years, and we have done lots of fantastically good small interventions around poverty, around access to fruit and vegetables, about this and that. And I have to say, we have not moved the dial. The obesity facts are still going up. We need something that is different. Obesity hasn't happened by accident. It's not because the whole world suddenly lost their self-control and their will to discipline. It's because the environment changed. Therefore, to unpick it, we have to change the environment. So what we did at the food board, after thinking about this for a long time, we did a London-wide ask for volunteers as such. We made people apply to get 2 boroughs, and we came up with Lambeth and Croydon, and we're working with them over a 5-year and then a 10-year basis to try to see, can we reverse this from the top to the bottom? We have buy-in from the Department of Health, Department of Education, PHE. DEFRA announced to us last week that they're going to trial their new procurement system. So if you don't bring the right stuff in, you won't get the right stuff out the other end. We're doing engagement up and down the community, and I really would love people to think this is somewhere that we could take this seriously. But I want to see this go further. I think that we could, literally as of tomorrow, start to do things like trial a sugar tax within that. We could start to work with the supermarkets to say, actually stop promoting Cocoa Pops, stop promoting these things. We know, because we've got the facts, that in fact promotions do not make people change brand. They make people buy more food. So we can stop that. We can put in all the measures around the schools. We can start to look at the fast food takeaways and say, you're not going to get your license again. Why can't we license them? We have this power in City Hall to do it. It's something we're talking about. And you're not going to get it unless what you offer is healthier. So there's a whole range of things that we can do, and we're poised to do them. We need help from the top. We've got everything else kind of in place. And actually, from all sorts of points of view of things that come through from the fantastic work of the Health Commission. If people eat together, instead of going down the takeaway for their evening meal, actually we get better communities. People are less lonely. Older people are less alone. We have put, under Boris's time, we've put 2,800 community gardens into London, which is 180,000 people, many of whom said, we were alone until that point. They cook together, they eat together, they have got healthier, and they've got healthier in their heads as well. So I'm going to pass over now to my colleague Mike, who runs the health for Croydon, because they have been implementing lots of these things. And together we can do it. Food is the single biggest thing that we could change to improve the health of our kids and of all of Londoners. Thank you.
So Croydon, Rosie said that we needed to deal with food from the ground up. So I'm going to start off by telling you a 1-minute story. my colleague was working at the Healthy Living Hub, which is a shop front just in front of our central library in Croydon. And about 5 o'clock one evening, a 12-year-old boy came up and said, Miss, can you tell me where the nearest chicken shop is, please? And I've got £1.50 here, and my mum told me to get something hot for supper. So this was quite a challenge to my colleague, who is now the programme manager of the food flagship programme in Croydon, because there was nowhere that you could go and get something hot and nutritious to eat in the centre of Croydon at this time of day. So she was faced with a bit of a problem as to how to respond to this teenager. What she did was that she sat down and said, well, actually, I'm sorry, I don't know if I can tell you where the nearest chicken shop is, but tell me about what you eat at lunchtime. And the outcome of this interaction was that the child went back to their school and started to look and see whether there was anything that they could eat at lunchtime, which would mean that they wouldn't be relying on having the chicken and chips in the evening. So there's a lot of things about that story that I'm not going to go into them. But one thing obviously is food is an issue which is linked in so many ways to other issues in our society. And the great thing about the food flagship idea is that it's given Croydon a way of actually encouraging aspiration and encouraging the whole community. Too often we make prevention quite a medical model, quite a negative thing, and there is something about this, which I'll tell you 2 or 3 of the things that we've done, which actually turns it around and makes it something that the whole community wants to sign up to. Everyone can agree that they want good health for their children. No one wants the next generation of children to grow up and not be as healthy as possible. So this is something that we can all align ourselves around. Whether we work in the NHS, local government, or the third sector, this is something that brings us together. So what have we done in Croydon to mean that that story about the teenager won't be told in future? Well, the first thing is our Eat Well Croydon programme, where we have employed a dietitian and a specialist to actually go and talk to the owners of our fast food businesses and find out why it is that they have difficulty offering a healthy option. That's quite a difficult road to follow. We've met a lot of people there who've said, well, actually, I'm worried that if I start offering a healthy option, I'll lose business. So that's an issue that we need to face head on. Personally, I feel that that as society, we owe it to ourselves to take more regulation, more powers over the density of fast food establishments. We've obviously been working in schools, and we've got flagship schools who then invite teachers to come from other schools to see what they're doing. And it's not just about diet, it's about school attainment. As Rosie said, children who are well fed and who are in good nutritional state are better able to learn. And one of the outcomes of the food flagship will be better school attainment over the 5 to 10 year period. We've also involved older people and volunteers through our Master Gardener and our Food Buddies scheme. So there's a lot of people there who might like to grow some vegetables in their garden but don't really know how to get started. So we've trained people up to do that, and we're giving volunteers the chance to buddy up with people who've got a bit of land who can in their garden, got a bit of space in their garden to actually start growing stuff. And then we've worked with to set up a number of small businesses to just get a business consultant to actually focus, and we've set ourselves a target of setting up 10 new small enterprises that will be involved in actually selling nutritious food in Croydon. So I think the last thing I want to say is about the ripple effect of all this. It's not just about managing child obesity and reducing the prevalence of type 2 diabetes. It's about the wider effects, the effects on school attainment, the aspiration that it gives people, the fact that they might think about stopping smoking if in fact they know that that is going to make the food taste better. And finally, and most important, the great, as it were, elephant in the room for all of us is the burden of mental health in our society and the impact that we can make through giving people encouragement to eat healthily. Thank you.
Hi there, I'm Steve Whiteman and this is my colleague Annabelle Byrne. As the theme of the day is about collaborative working, we thought we'd do a double act this afternoon. So I'm the Director of Public Health from the Royal Borough of Greenwich, the Council, and Annabelle is the Chief Officer of NHS Greenwich Clinical Commissioning Group. So a few images from around the borough. I won't ask people to shout out the ones that they recognise, but really just to highlight that Greenwich as a place has many assets, some of them internationally known, but it also has many challenges. You'll see one of the many local authority estates in the bottom middle there. We have 3 prisons, one of the biggest prison platforms in Europe in our boundaries. So a borough of great contrasts. What we're going to do as the second sort of borough example giving you is to give you a flavour of some of the collaborative work that we've done, particularly around prevention in Greenwich. I could have talked about food just as happily as tobacco, but I would have said many similar things to those that Mike's just said, of things that we've been doing around food in Greenwich. But we're going to talk a little bit about tobacco control work that we've done as an example of collaborative work that we've been doing for a number of years in the borough. We're going to mention our health and wellbeing strategy, which has many echoes with the themes that different speakers today have been focusing on. And we're going to give you some thoughts about our thinking in terms of the next steps across our agencies and how we want to really get more systematic and serious in the way that prevention is embedded in our work. So first of all, tobacco control. We had a starting point, very high smoking prevalence in Greenwich, very high rates of lung cancer, respiratory and cardiovascular disease mortality. And we've been working collectively in the borough for more than 10 years on a wide platform of tobacco control work. I've listed there some of the different agencies that have been part of that work, sustaining our relationships over that number of years. One particularly important partner has been our relationship with Charlton Athletic Community Trust. The football club have a community trust arm that do a lot of excellent community work, and we've been working especially closely with them. We've also been working with boroughs across South East London on the enforcement work. It was mentioned earlier on about the burden of ill health that illegal tobacco is contributing to, and we've been really doing some, in fact we've got a campaign out on the streets of South East London at the moment called Keep It Out, which is really about trying to take illegal tobacco out of our area. So as I mentioned, we've had a tobacco-free partnership with a focus on prevention, cessation and enforcement. Some of the characteristics of that work that I think are particularly notable in our area are since 2006 we've had a very high profile, constant street presence in high footfall areas of the borough in partnership with the football club, and each of those campaigns that we run, and we run a number of them throughout the year, reach tens of thousands of our population, and we know from adding it all up that we have had conversations with more than half of our population through those campaigns, and that's been going on year in, year out for a number of years. I've mentioned the enforcement work. The other thing that we've been keen to do is to keep the profile of tobacco very high in the media. So we aim to have at least one story every month in the local press about tobacco. So at the moment there would be Stoptober and the smoke-free cars legislation, for example. So here are just some examples of the kinds of campaign activities that we do and the branding that we've taken over those years. Testing people's lung age, Make This Time the Last Time, Smoke-Free Cars and Homes, and Stoptober. And people in Greenwich recognise these road shows and come to the people that staff them and have those conversations. And here again are some examples of the kinds of articles in the local press that we actively seek to have on a regular basis. Now, we can't claim that this is entirely down to our work, because it's difficult to prove, but here is what we think we've contributed to in terms of the impact. So you'll see we're the sort of gold-yellow line in 2010, high smoking rates, significantly higher than our IND comparators, London and England, going down to a much faster reduction. Everywhere is reducing, but a much faster reduction in 2013.
So I'm just going to pick up from that particular story about tobacco control to talk about how we're trying to mainstream, we're trying to learn ourselves from that success and look at how we can scale up. We've got a health and wellbeing strategy called Healthy Greenwich, Healthy People. And it's important that it's called that. We've talked this earlier on this afternoon about the individual choices people can make, but our strategy really commits to creating the circumstances where people can make better choices in Greenwich. We have 4 priorities. You would expect us to see tackling obesity and well-being, but that isn't just, again, about the individual. It's about how we tackle loneliness, and how we support access to healthy food. So it isn't just about the individual, it's about the environment. We've also got 2 other cross-cutting themes, so the health of staff of our organisations, an investment in our staff. There's a good economic case for that, which has been well made, and I think you're going to hear more about that later. But our organisations there aren't necessarily just public sector. They could be private organisations as well, because the economic case stacks up for them too. And making every contact counts. So really investing in our frontline staff, whether that's the receptionists who have contact with people or our professional staff, and enabling them to feel really confident to have those conversations, to motivate people to make a difference in their lives, and having an infrastructure for things like social prescribing so that people know where they can access help and support. But we're also looking more systemically at the new models of care, and so we work across South East London, the 6 CCGs and boroughs working together, and our strategy is called Our Healthier South East London, and that has a particular prevention work stream focusing on obesity, smoking and alcohol. We also are developing our local care networks. These are based on the footprint where GPs are coming together. So in Greenwich, we have 41 practices, but now we have 4 GP provider networks, and we have contracts with them to provide improved outcomes for people with long-term conditions. We're increasingly developing the working relationships so that mental health services now map onto the same geography, as do our community and Royal Borough of Greenwich services, and increasingly the voluntary sector. So that gives us a platform from which we can now start commissioning prevention services more systematically. So I'm just then going to share with you our population segmentation approach. So this is an approach that we've adopted across South East London, and this picture is the Greenwich population. It's known now as the Christmas tree model for obvious reasons. The pyramid that you can see at the top would be one you'd be familiar with. So 1% people who are in the end of their life, about 8% with 3 or more long-term conditions, and I can't read the blue from here, but it's usually about 25%. Thank you. Who've got one long-term condition. What's different about this model is normally you have a pyramid with a flat base. We've broken that out to the 51% who are experiencing inequalities or their health's at risk. And in the video at the beginning, it talked about people who are putting the quality of their life at risk, and I think it's that population. That leaves you with just 15% below who are healthy adults, which I think if you haven't seen the model before, that always feels a little alarming. And then you think about yourself and you look around the room and you think, no, that's probably about right. What we've just done recently is the bar chart down the left, we've mapped the spend, and that's the dark blue line, against the percentages. So I know it'll be difficult to read, but what you can see is the differential spend against each of those levels. We've also done this for adult social care. So I just want to point out this is only adults, so you see the bottom, the stem reduces to 6% by having removed the children, which is worrying in itself. But I'd just like to, if you look at the end-of-life care spend there, and then the end-of-life care spend there. The opportunity that Simon Stevens talked about earlier was for us to challenge ourselves to say, are we getting the best value out of our investment? If we're spending that amount of money on end-of-life care from health and social care, are we joining that up and making quite sure that patients are getting the best outcome? So for us, this is at an early stage. We haven't yet got primary care mapped onto here or public health. We're looking at a whole forest of trees, but then to bring them together because they're all on about the same population. What we know is that through the work that Steve talked about earlier, about 12,500 people have quit smoking over the last 3 years in Greenwich. They will have improved the quality of their life significantly and maybe moved from the white box down into the green stem, but they may also continue to be having a long-term condition. Our challenge is to work at scale and collaboratively to keep people as healthy as possible for long as possible so that we make the best value use of the money that we're investing. Thank you.